Hello guys, welcome to Medical Ward, BSN 3E Group 2, third rotation NCM 116 Early, Nursing Care Management 116 Early, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our second week, and of course our focus for this week is all about case scenario of patient EF diagnosed with multiple sclerosis. But before that, please allow me to share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share our learning outcomes for this week. On completion of this case study, student nurses will be able to first, build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on a case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. And also, please be reminded of the following instructions. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and also the paper size. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor, and it is advised that you will submit all your requirements on or before the set deadline of submission. Furthermore, please kindly follow this format in saving your requirements for easier monitoring for the daily requirements. Abang underscore Joseph underscore W2 D1 NCM 116 RLE for day 1, Abang underscore Joseph underscore W2 D2 underscore NCM 116 RLE for day 2, and for your weekly requirements, Abang underscore Joseph underscore W2 underscore NCM 116 RLE. Let's now have your case scenario of patient EF diagnosed with multiple sclerosis. Case history. Patient EF is a 25-year-old man, a call center agent in one of the BPO companies in the city, an Iglesia Filipina Independiente by faith, currently residing at Barangay 48, Cagayan de Oro City. He is admitted in the Neurology Medical Unit of Maria Reina Xavier University Hospital. His admission in the unit was referred by his internist who suspects him of having symptoms of multiple sclerosis or MS. Patient EF has experienced increasing urinary frequency and urgency over the past 2 months because his female partner was treated for a sexually transmitted infection. Patient EF also underwent treatment, but the symptoms did not resolve. Patient EF has also recently had two brief episodes of eye fussiness associated with diplopia and flashes of brightness. He has noticed ascending numbness and weakness of the right arm with the inability to hold objects over the past few days. Now he reports rapid progression of weakness in his legs. Diagnostic tests were ordered to rule out patient EF's condition, and results are as follows: CSF analysis, presence of mononuclear cells, and elevated IgG. MRI, multiple focal lesions; EEG, abnormal electrical signals; evoke potential studies, slowed conduction of nerve impulses. Patient EF is diagnosed with MS. He confides in you that he has been depressed since his parents get annulled and the onset of these symptoms. He tells you that he knows his girlfriend hasn't been faithful, but he's afraid of living alone. He's afraid if he tells her about his MS diagnosis, she'll leave him. Patient EF was prescribed to receive the following drugs in the management of his condition: interferon beta 1A, Avenox or Rebif, 30 microgram IM per week; interferon beta 1B, betazeron, that's 0.0625 milligram subcutaneous every other day; glitiramir acetate or your copaxone, 20 milligram 3 times a week; itosanthron or your dobanthron, 12 milligram per meter squared intravenous piggyback. Patient EF was discharged from the hospital and appropriate referrals were made for support groups. He takes advantage of his time with a psychiatric nurse specialist, joins a local MS support group, and tells his girlfriend to move out. He later marries a woman from the support group. Let's now have your high five critical thinking questions. Let's begin with number one. MS is an inflammatory disorder of the nervous system causing scattered, patchy demyelinization of the central nervous system. What does myelin do? What is demyelinization? Again, MS is an inflammatory disorder of the nervous system causing scattered, patchy demyelinization of the central nervous system. What does myelin do? What is demyelinization? Number two, MS is characterized by remissions and exacerbations. What happens to to the myelin during each of these phases? Again, MS is characterized by remissions and exacerbations. What happens to this myelin during each of these phases? Number three, isn't patient EF too young to get MS? What is the etiology? Again, isn't patient EF too young to get MS? What is the etiology? Number four, outline the subjective and objective assessment data that you would gather because a diagnosis of MS is suspected. Identify those symptoms manifested by patient EF. Again, outline the subjective and objective assessment data that you would gather because a diagnosis of MS is suspected. Identify those symptoms manifested by patient EF. Number five, as part of your teaching plan, you want patient EF to be aware of situations or factors that are known to exacerbate symptoms. List 4. Again, as part of your teaching plan, you want patient EF to be aware of situations or factors that are known to exacerbate symptoms. List 4. Let's now have the daily requirements. Of course, for your day 0 Sunday, that's case scenario loading. Day 1 Monday basic is your GOSODPA Series 1 nurse's notes, and that is going to be your FDAR 1. Initial knowledge about the case, physical assessment, pathophysiology, diagnostic test, and of course your drug study. For day 2 Tuesday, basic includes your SODPA Series 2, nurse's notes, FDAR 2, weekly evaluation, reflective journal reading, and of course your critical thinking answers. Initial knowledge of the case that includes your problem list, nursing care plan, and also the discharge plan. Weekly requirements, of course, you know this one. You have the introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, references that has to be on an APA style. Deadline of submission for your requirements. For day 1, the deadline is March 29, 2021, Monday, 11:59 p.m. For day 2, deadline is March 30, 2021, Tuesday, 11:59 p.m. For week 2 requirements, deadline is April 3, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details, my email address, my mobile number, and also my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.